541, we are continuing our coronavirus coverage with this week's edition of Better Health.
Asante's Julie Zetterquist and Beth Coker sit down with me to answer some of the biggest questions being asked. So today we're talking about the coronavirus, obviously something that's on a lot of people's minds these days. How do you know if you have the coronavirus?
Well, coronavirus is spread mostly through interaction with close contacts and that sort of thing, and we're really seeing it still just travel related. There's a very low risk in our community for community spread, and so if you have traveled internationally and if you've had close contact with somebody who's traveled internationally and start to develop the symptoms, which can be fever, shortness of breath, lower respiratory symptoms, that's how we're starting the pathway of screening for that test. Otherwise, again, the risk for this community spread is very, very low.
So Julie, if I have a fever, runny nose, cough, what should I do about that?
So what we're asking for people is if you do have those symptoms showing up and you feel like you need to seek the interaction with a healthcare professional, to please call your primary care physician and set up an appointment with them. Calling them first is very, very important so that we can minimize the spread of this contagion they'll do some screening over the phone and determine whether or not you need to come in for a visit. We also have video visit capability through Asante, so we're using that a lot.
And what is Asante doing to prepare just in case we have an outbreak of the coronavirus in Southern Oregon?
Sure. We're doing a lot of communication internally and with our community partners. We have daily phone calls, task force meetings. We have operations set up so that we're prepared to handle one patient that might come into our hospital or many, many patients that might come in.
So how can I avoid getting this virus? Should I mask up even though I feel great?
I'm glad that you're asking that because no, the answer to that is no. Masks are for people who are sick. And so if you have any kind of a respiratory thing going on, we ask that you mask yourself. The idea behind the mask is not to protect people who are well, but to keep that contagion from spreading. So anybody who's sneezy or coughy is the one that can spread that, and keeping that mask over your face is what's going to keep your germs to yourself.
So better safe than sorry here. If you're feeling like you're coming down with something, just give your health provider a call.
Absolutely.
Make sure everything's all good.
We're still really in the height of flu season. We're seeing some other viruses that often emerge around this time of year. We're also seeing allergies and those kinds of things. And so people are suffering, but it's not necessarily from the coronavirus.
All right. Good stuff. Thank you. We'll be right back.